Here is your question.
Okay.
Okay, so if you have read and understood, considering its surgical anatomy, kindly tell me, what are you looking at? What is this?
It is a skill.
Skull?
Skulls.
Okay. Which
A
view?
skull. Coronal section.
Okay. Can you see there it's divided into certain parts? Can you tell me, can you identify what is this part called?
Yeah, okay. This is like a laser ring of sphenoid.
This is
like
the
frontal, you mean
cranium, so
frontal?
it's anterior cranial fossa.
Yeah, it is anterior and middle and
And
posterior
this is the
fossa.
middle and this is the posterior. Can you tell me the boundary of posterior cranial fossa?
Okay, it will be like from from vitreous part of the temporal bone till the anterior occipital protuberance.
Yes, anteriorly would be
Anteriorly, the line of
what is this
vitreous
called?
part of the temporal bone and clavus.
And vitreous part of the temporal bone, yes. And posteriorly,
Yeah.
what is this?
This is like occipital protuberance.
Occipital bone, okay. Laterally?
Laterally also the occipital bone, right?
No, have a look. Squamous and mastoid part of temporal bones.
Yeah, side part of temporal bone. Oh
Okay,
my
and
God.
superiorly?
Superiorly.
They say tentorum cerebelli. What about inferiorly?
Inferiorly,
Yes.
foramen magnum and
Yes, good. Can you tell me what are the bones which are involved in the formation of posterior cranial fossa?
we have the occipital and also the vitreous part of the temporal bone and squamous part of temporal bone and small part of the clavus, like small part of the sphenoid bone.
Okay, good. Can you tell me what passes through this number 11? What is this number 11? Can you identify?
Number 11, this is foramen magnum.
Yes. What passes through it, please?
Like a spinal cord and also vertebral arteries and spinal accessory nerve came with it,
And many other things.
brainstem.
Yes, and lower end of medulla oblongata, tectorial membranes, anterior-posterior spinal arteries, apical ligament of Dens.
Yeah, ligaments.
Spinal root of accessory nerve. Okay, can you please identify number 27 over here?
27.
Yes.
This is the carotid foramen.
I'm asking.
Yeah, it is carotid.
Okay. Are you sure? Okay, what is 30?
30 jugular foramen.
Okay, what passes through it?
We'll have like 9, 10, 11 cranial nerve, and also we have sigmoidal sinuses and inferior petrosal sinus and also from the regular foramen, we'll have the meeting of spinal and cranial part of the accessory nerve. And there is fizzles, but I couldn't remember the fizzles.
Which one?
There is fizzles, but I couldn't remember the
Okay,
fizzles.
vessels. All right. Maybe you can tell me. Okay, some more important points I want you to identify, please. If you can identify number 1.
Number 1, it is like anterior clinoid process.
Okay, number 32 over here, if you can identify this.
This is laser wing of sphenoid.
Okay, if you can please identify number 13.
13, it is foramen rotundum.
Number 12 below this.
Foramen oval.
12 is oval, yes. Okay, if you can identify number 14, where is my cursor? 14 over here.
14. This is foramen spaniosum.
Very good. And number 37.
37. 37. It is the area of vitreous part of the temporal bone. Yeah.
Very good. Okay, if we are moving on this side, number 42.
42, it is like a superior orbital fissure.
Okay, and yes, and MCF.
MCS, where is it?
Yes, here.
Yeah, okay, it is the area of middle meningeal artery.
Okay, what does that mean?
Squamous part of the temporal bone.
44.
44 is superior sulcus of the vitreous part of the temporal bone.
What do you understand
No.
by trigeminal impression?
Yeah, it is 44, this trigeminal.
What does that mean?
The area of trigeminal ganglia and the branches coming from it.
Okay, if you can identify number 8 over here, please.
Dorsum celli.
Yes, and 34, please.
34. Like the opening of the optic canal.
Okay, so what passes through it?
Optic nerve and ophthalmic artery.
Okay, and anything else?
Maybe a measure vein. No.
All right, can you please tell me, few seconds are left. Okay, can you please tell me what are the contents of the carotid canal? Where exactly is it located?
Carotid canal, it's like in just 1 second. Carotid canal will have the carotid artery and sympathetic plexus, and it will pass above the foramen spaniosum, foramen lacerum, and just above the foramen lacerum. It not pass through it.
Identify here the carotid groove. Number 3.
Yeah. Yes, number 3.
Yes, it's here. So that's exactly where these are. Can you tell me what is cavernous sinus?
Cavernous sinus is like a sinus in the both sides of the pituitary fossa, and it's contain carotid artery and the abduced nerve in the middle, and in the side we have like a third cranial nerve and fourth and ophthalmic and maxillary part of the trigeminal, and is like one of the sinus drainage of the brain.
Okay. Can you tell me what you understand by the term cavernous sinus thrombosis? When does it occur?
scapular sinus thrombosis when you have infection from the dangerous area of the face,
Spread to,
from
yeah,
from the superior ophthalmic artery, vein, and it's as a direct relation, and indirect from the facial vein and pterygoid plexus of vein through the imagery vein, and this area of infection lead to thrombosis of the scapular sinus.
okay. How would a patient present when
Patient will present with uh, the ophthalmoplegia and
painful swelling of the eyes
painful swelling of
and
the eyes.
cranial pulses of third, fourth, fifth, and sixth,
Yeah,
and gradual loss of vision.
loss of
Good.
vision.
Good. Hypoglossal canal we talked about. Can you tell me what does it transmit?
Hypoglossal canal transmits a hypoglossal nerve
Yes, and
and
ascending pharyngeal artery.
hypoglossal canal. Ascending what, please, ma'am?
Ascending pharyngeal artery.
Okay.
Good. Thank you. Right.